All right, gang. Thanks for coming. Thanks for your patience in allowing us to get set up. Welcome to Team Healthcare Clinic, and welcome to those of you who are watching me online. We're actually filming this so that people can maybe watch this later without having to come to the clinic. So I will be speaking a bit into the camera, but welcome to all of you. For those of you who don't know, my name's Dr. Tim Bertsch. I'm one of the chiropractors who practices at Team Healthcare Clinic. I am going to be talking about thyroid hormones and stress and digestive health, which may make you pause a little bit as to why a chiropractor is doing this talk. And in fact, I have a specialty degree in internal disorders. So this is, I would work therefore with the type of conditions that most medical internists work with. So we're talking digestion, we're talking cholesterol, we're talking all kinds of things like that. My care does not involve medicines. And as I get into my talk here, you'll see why I don't think that's always the best idea. My care does involve changes in diet and nutrition and lifestyle, which interestingly enough, over 35 years of practice, but 20 years of doing as a specialty, that is more powerful than the medication could ever hope to be. So, away we go. Does anybody have any idea where that picture is of as we're looking there? That actually is Lake Louise in Canada, and I want y'all to know I took that picture. I am not that good a photographer, so I had to include it in something somebody's going to see. I like this. Those of you who get that are of a certain age, sorry to say, and I'm of that age. What can I say? I'd like to take a moment and show you this video. This is someone who actually did have thyroid issues and came to our clinic. And it's very interesting to hear what she has to say.
My name is Jill, and I came to Dr. Tim originally for Hashimoto thyroiditis, and I was unable to function normally during the day. I was actually pretty much ready for a nap at 3 o'clock. By 6 o'clock I was just down for the count, ready for bed. I'm a night owl, so this wasn't working really well for me. And after about 6 months or so, I wasn't getting any solution from my endocrinologist, so I came here to Dr. Tim to see what we could do, because I was going to be changing to 4 10-hour days, and there was no way I was going to be able to make work happen with the 4 10-hour days. So I came here, I started seeing Dr. Tim, and went gluten-free. My diet has changed. I have actually started losing weight, which was another one of my goals. And then I started seeing Dr. J at the same time to help me with balance issues. He actually took care of a shoulder issue that I had that wasn't getting taken care of properly by physical therapy that I had for several years. And just one treatment alone was able to get my shoulder pain-free, which was a godsend. I'm able to sleep again and function with the use of my arm. The other thing is the vertigo. I thought several years ago with medication that I took for a month was gone, till I laid flat on my back and realized the vertigo was not gone. And he took care of that as well. And my balance issue, I can't believe how much it has changed me. I'm able to do things with my eyes closed that I couldn't even do with my eyes open. And I highly, highly recommend both of these guys.
Kind of nice to be one of the guys. What's interesting about her story is that she actually was working with an endocrinologist. She was on medication, and according to the testing they were doing, her thyroid was all balanced up. Still, she had all of those symptoms. So there was obviously something missing in there, and really that's what we like to try and address, is what is the cause of that. This lovely lady with me here is my wife, Diane. I dedicate that, well, first of all, I show this because it shows I married up, but I dedicate this talk to her because when our daughter was born, our first child 29 years ago, it was discovered that she had thyroid problems. And so it's been a special interest of mine as we've gone through the years to figure out just what in the world can be done besides simply supplying medication for thyroid disease. And that then opened me up into a whole new world of all kinds of fun stuff. So that's partly how I'm at where I'm at today. I like to use this analogy. We're going to start with this of a tree. How many of you have been to the doctor and they said, with a problem, and they said, oh, let's send you to this specialist. And then you have another problem, and they send, oh, we'll send you to this specialist. And people now are not talking to each other. It's kind of like this tree. If we had a branch that was not doing well, we'd call out the branch doctor. And then if there was a leaf on the other side not doing well, we'd call that leaf doctor. And before you know it, we've got all kind of people in the tree not necessarily addressing what? The roots of the problem. What was making it do that? So that's my analogy. So symptoms are out there in the leaves. And granted, if that's as good as you can do, well then do it. But one must always think about, golly, what are the causes here? So the causes are somewhere in the roots, and we want to really, truly get to the root of the problem. I like to introduce this as well, too, this idea of this triangle of health. In our clinic, we divided care into categories. Other clinics do it similar things. This is how we like to look at the body. So you will notice that at the top is basically nervous system, brain, and how it functions, which makes some sense. It controls everything that's going on in our bodies. It senses the world around us and tells us what to do. If that's not working at 100%, we kind of have a no starter, don't we? On the one corner, you will see structure. And that makes some sense. We have in our clinic, we have chiropractors, we have physical therapists, we do a lot of physical medicine. Yes, that is structure. And certainly your structure has to be performing as close to 100% as you can possibly get it to be. And on the other corner is chemistry or biochemistry. And by that I mean all those chemical reactions that go on inside of our bodies. Medication works by changing some bit of chemistry. This is where nutrition falls in. So we need to feed our bodies what we need to feed our bodies to get the chemistry right. And so that has to be functioning as close to 100% as we can get it. Notice there's double arrows between all of that because nothing occurs in a vacuum. This all works together. So you can't have a problem in one area without it to some degree affecting the others. And the longer the one problem goes on, the more it's going to probably affect those others. Here's an example, kind of real world in my world. You lift a 2,000-pound boulder in the backyard and you put a crick in your back. You're going to come in and see me as a chiropractor who can fix the crick. Or you're going to go to the physical therapist who's going to work with you and rehab those muscles. And if we get to it right away, it won't be a long problem. But while it was there, it was affecting how your brain works. You have that pain sensation that's always there. That's going to have an effect. It's going to have a biochemical effect. The inflammation and all of those, that bit of chemistry that goes along with it. But if we fix the structure right away, no big deal. What if you lift the 2,000-pound boulder in the backyard and you wait 10 years to go do something about it? Now you're in chronic pain. Chronic pain over a period of time is going to have an effect on those other areas, and maybe now there's some permanency to it, or at least some lasting quality to it. So yes, you come into the clinic and we fix the crick in the back, but you've had this for 10 years and you have a chronic pain syndrome going on. We might need to deal with how your brain perceives pain. You have a whole bunch of inflammatory changes. We might need to deal with taking care of that inflammation, both dietarily and in nutrition supplements, in order for you to actually fully feel as good as you should feel. So that's another concept I like people to be aware of, is that how integrated we all are. We're not just single pieces to be taken care of, but we're a whole body that needs to be taken care of. There is, as I see it, a crisis in healthcare. I mean, my golly, the costs keep escalating, and people keep trying to figure out ways to take care of it. And I honestly don't think there's going to be an answer unless and until we realize a few things and start to deal with them. Basic things. I found this statistic the other day. According to the World Health Organization, 88% of disease in the United States is due to chronic disease. In other words, stuff that has been with us for a long time. In other words, things that we maybe could have dealt with early or prevented. Healthcare in this country doesn't always deal with chronic disease real well. Chronic disease tends not to be real amenable to medication. Don't get me wrong. I get run over by a car, I get hit on the highway in front of the clinic. Don't take me to me. Take me to someone who can do some crisis care and make it so I don't die and get the men starting. But after that, yeah, I prefer to work with somebody who's going to work with the basics. Make sure my body's working as good as it can be. But there's a lot of chronic disease, all the way from cardiovascular to diabetes to even cancer. First thought in healthcare system is this. What's the medical condition there? Give it a name. Give me a diagnosis. It's a great way to communicate amongst professionals, but our problem sometimes becomes, I put a name to it, I'm going to give you a medication for it. You just fit into the pigeonhole. And I have something else pop up, and you're going to get another medication, and you're going to get another medication. And nobody asks, well, why did this happen in the first place? Unfortunately, pharmaceutical companies are driving a lot of this idea. They train the doctors, or they pay for the training of doctors. They educate doctors after they're in practice. What are they going to want to do? Well, I'm going to make it pay. I get that. But that isn't always necessarily the best way to go. Thyroid, diabetes, hormone imbalances, one can potentially end up with a prescription for life. And truly, if that's all you know how to do and it's life-saving, who's going to sneeze at that? But what if I said much of that, if you can get to the root cause, you don't need anymore? Would that maybe be a better way to go? A 2013 statistic, I actually tried to find more up-to-date ones. There were some out there, but I didn't have as good a graphic as this. So the current statistics are very similar to what you see there. There's a lot of money involved. And when there's money involved, there's a lot of politics involved. We wish that weren't so, but unfortunately there's realities that we have to be aware of that. Chemistry. I hate to pick on Monsanto. Actually, I don't. They're big. They can handle it. That's not too far off, that picture there. We do deal with people, for example, that have wheat sensitivity, gluten sensitivity. That's a real thing in the world. That's not just a fad. And part of the reason that is so is because of how we process food in this country. It's a very chemical process. In fact, I've dealt with farmers who we've had to deal with chemistry and detoxification because they got sick at what they were doing. This is the old food pyramid. I find it all the grains and all the cereal and all that junk at the bottom. In other words, you're supposed to be eating more of that. That's how we were brought up, wasn't it? No, this is a better thing. Now we've got good stuff at the bottom. We've got water, and then we've got our vegetables, and then we can bring in some meat and a few grains and maybe a little dairy. And no, dessert is not one of the main courses we need at a meal. I'm going to turn and read this. What drug is this? Symptoms associated with that: malaise, abdominal discomfort, blurred vision, blood sugar problems, nightmares. Sounds like fun, doesn't it? That's Lipitor. So medication, for however useful they are for something in your body, is read as in your body as junk. Junk to be gotten rid of. And consequently, there are side effects, and so that is some of them. This is an interesting ad, and it shows something called relative risk. I like this a bunch. So Lipitor helps prevent heart attack, 36%. That's a big deal, isn't it? But notice the lower left-hand corner there. We need to look at the fine print, and really what it says is that 2 people out of 100 will have a heart attack. 3 people out of 100 will have a heart attack. Those on Lipitor, only 2 people will have a heart attack. In other words, it saved 1 out of 100. That's a third. It's a risk-reward. Is the risk worth the reward? And if there's alternatives to the Lipitor, how big is the risk then and the reward? How about this one? Insomnia, nausea, abdominal pain, chest pain, migraines, ringing in your ears, tremors, vomiting, flushing, abnormal dreams. Oh, and I'll add a risk of suicidality in a certain percent in kids and adolescents. Antidepressive medication. Are there alternatives? Yes, there are. Has anybody told you about them? Probably not. What drug is this? Dizziness, fainting, racing heart, confusion, hallucinations, seizures, weakness, sore throat. Those are the biggest ones, and then the rest of them are in there for your viewing pleasure. Cipro, that's an antibiotic. Are antibiotics useful? Yes. Have they helped many people that otherwise would have died? Yes. Are they overprescribed? Yes. Do they have consequences in your system? Yeah, they do. So if you're going to take one, maybe you ought to know how to counteract some of those consequences. Unfortunately, medical care, even properly done, has consequences. It's a risk-reward thing, and that's what a lot of people. Are the pharmaceuticals and medicine to blame for all of this? No, probably not. Here's a great example. How many of us actually get off our keisters and move around in the course of a day? How many of us exercise like we're supposed to? How many of us eat the diet we're supposed to? What do you think? Anybody you know? Anybody you're related to? Yeah, we're responsible for this. It's not a secret pill that we take for good health. And that's one of the biggest things I try and get across to people. If you're looking for the single pill, it doesn't exist, it never will exist. We're too complicated. Can we help ourselves? Yes, but you must help yourself. Clinics like ours can guide you, but you must do it yourself. Stress. Yes, we have stress. That too has a negative effect on health. So there's the physical stress. I lifted a 2,000-pound boulder in the backyard. There's chemical stress. Blamed Monsanto, but guess what? We do it to ourselves as well. Yeah, I'm having that bottle of wine every night. Don't ask me to give up my wine. We might have to if you want to be healthy. Emotional stress. Absolutely. Talk about the bear. You know, we are designed to deal with the bear. There's physiology that changes in our bodies. We need to either fight it off or run away from it or be eaten by it, but we're designed to get over that stress. What if you live with the bear 24/7? What if you have a bear at work and a bear at home? Just thinking about the bear makes us act as if the bear is here. So those are issues that people really have to deal with. You were here to talk thyroid, and I do want to spend some time specifically talking about that, and then we'll branch out, I think, a little bit again into autoimmune disease. Your thyroid sits here in your neck. You have two poles with a strip across the middle called the isthmus. All of that makes thyroid hormone. Supports a lot of stuff. Bone metabolism, your immune system, brain nervous system, your gut, your liver and your gallbladder, growth and reproductive sex hormones, burning fat, absolutely we need a good thyroid for that. Blood sugar and how insulin deals with sugar is controlled by and is influenced by having healthy cholesterol levels. Proper digestion, proper stomach acid. If you don't have enough thyroid, you will have a much more difficult time digesting your food. Symptoms. That's a dog I used to own, Jasper. It was his favorite place to be. He crawled up on my leg there. I get home at night, and this is the way we would. That's relaxed, ladies and gentlemen. But how many of you feel like that all along? You know, it was time to go out and walk and play. Jasper could get off and go do that. How many of us are just not? I just can't. I can't play with grandkids. I can't play with. I'm coming home from work. With my wife, we knew she had a problem because she took, fortunately, some time off from her work when the baby was born. I would at home and she would literally hand me the baby. Here, I gotta go to bed. She could barely get through the day. Something's wrong. Thinning or losing hair, absolutely. Your thyroid is in part responsible for that. Constipation. We are talking in these slides at this point about hypothyroid disease, underactive thyroid. This is the most common form of thyroid that people have. So think of your body slowing down, including transit time in your gut. So constipation is a big deal. Depression. When people come in wondering or have symptoms of depression, or you're a family practice doctor, I really want to make sure that two things are checked before they say, here's your antidepressive medication. Number one is thyroid, because decrease in thyroid function will make you feel depressed. Number two is checking if you're anemic. Anemia will make you feel fatigued and depressed and all that as well. So, or right script out for you to have an antidepressive medication. Morning headaches is a very interesting one. As a chiropractor, I deal with people with headaches and quite successfully. But there's a group of people that when somebody's coming into me saying, yeah, I'm waking up with this headache and it's gone as I go through the day. And it just gets repeated day after day after day, no matter what I seem to do. Not conclusive, but now I am suspicious of maybe checking their thyroid out. Gaining weight. Remember, one of the things thyroid helps is fat burning. Doc, I exercise and I exercise. I don't feel like doing it. I go and do it. I just can't lose weight. Might be one of those cases. Cold hands and feet. I am doing this talk from the great state of Minnesota. It is currently about, do we have any degrees out there today? I don't even think so. Yeah, we have cold hands and feet a lot, but I'm talking something different. No, everybody else is warm and toasty, and man, mine are cold all the time. I gotta wear socks in the summertime. Yeah. Mood swings. We are now starting to get into some hyperthyroid symptoms. So instead of your thyroid being sluggish and slowing down, it can rev up, it can speed up. You can make more thyroid hormone. That's also that's hyperthyroid disease. So one would feel, then think of being sped up. One would feel more nervous and emotional, jittery, that type of thing. Can't sleep at night. There's many causes for that, but one of them could be thyroid disease. Yeah, I lay there and I lay there and I lay there. Night sweats. This is a possibility. Little physiology that I want you to be aware of here. It does start with your brain. Remember I said at the beginning your brain senses the world around us and tells us what to do. Senses both external environment but internal environment. And a signal, something called the thyroid releasing hormone, comes from your brain, we'll say, hypothalamus, and goes to your pituitary gland. Your pituitary gland sits at the base of your brain, to which the pituitary gland responds and sends off something called thyroid stimulating hormone, TSH. Many of you with thyroid have probably come across this TSH verbiage somewhere, and that's what it stands for, thyroid stimulating hormone. That is from the thyroid actually to your thyroid gland, to which your thyroid gland will respond, and it will make mostly T4. That's what it makes. So a tyrosine with 4 iodines connected to it, and a little bit of something called T3, 3 iodines connected to it. The T4 circulates around your system. Here's the interesting thing. T4 is really not terribly active in your system. It doesn't do a whole lot to rev up your tissues. So your body, so this T4 stuff circulates around your body and hits various organs, primarily your liver. And there's an enzyme in these organs that hacks iodine off that and makes more T3 out of it. It's the T3 stuff that is the bioactive stuff. That's what makes your cells rev up. I ask you, if you want to think about it, how many of you have had your T3 actually tested? Chances are maybe not a lot, and the reason why is because most of the medication is T4 exclusively. If you make enough T4, your brain says we're good, and your TSH number will come back to normal and everybody will be happy. You'll still feel terrible. Everybody else is happy, and your likely medical doctor. It goes, including your gut. A good, healthy gut is important for this because some of that conversion actually takes place in your gut as well. So what about this? My tests are normal. This was the patient that I had the video of. She came in and said, my tests are normal. Were they really? Let's figure out what normal is here. So normal, and we're talking laboratory normal, is really determined by statistics. So what happens is, the medical doctor, or the lab rather, with orders from the medical doctor, we get a lab drawn and we get TSH measured. The lab plots all of that on a graph and gets a bell-shaped curve. So the 80% in the middle is now declared normal, which is an okay way for us to determine normal if we test a lot of healthy people. What happens is the order goes in and the lab does a statistical analysis and says point A to point B is normal. Okay? But that's done on a bunch of sick people, which kind of skews our result. So there's a difference then between that which is laboratory normal, and optimal. We'll call it functional. We call it the functional range. And most labs have something like, for a TSH, a 0.2 or a 0.3 at the low end, up to, I've seen it 4.0 up to 5.0 on the high end. And this is the interesting thing, because it's done statistically, it varies from lab to lab to lab. You could have a TSH of 4.2 and the lab says that's normal, and you go to a different doctor and the lab says 4.0, in which case you'd be abnormal. Do I need meds or not? There's a more functional range, and the range we like to use around is 1.8 to 3.0, and that's actually what the endocrinologists have determined an optimal range should be. So if you're outside of that functional range, do you have a disease? You do not. Might you have symptoms associated with it? Yeah, you might. So we are looking with all the testing we do to try and get people into that range, that optimal range, because that's where healthy people really should be living. There are actually different types of thyroid. There's different reasons why people respond as they do. So how do I know which I have? Is it because I'm not making enough thyroid releasing hormone from my brain? Is it because my pituitary isn't doing what it's supposed to do? Is it because my thyroid gland isn't doing what it's supposed to do? Is it because I'm not making enough T3? And if I am, is it because it's not getting to the places it needs to get to? All those are possibilities. How do we know? You have to do the right testing in order to figure that out. So, could you have a problem with your thyroid gland itself? Yes, and that's probably one of the more common things. Is it because your pituitary is not working? Is your thyroid too active or not active enough? And it
depends on what time of day
it depends on where you're at. Thyroglobulin is a protein. And thyroglobulin is a protein that actually carries the thyroid hormone to the places it needs to be. Well, it competes with estrogen. So are you on estrogen replacement therapy? If you are, that might have an effect on the available space for that thyroid hormone to float on, in which case it might be affecting how you respond to what you're being given. Thyroid resistance. In other words, yeah, everything worked like it was supposed to. It got to my cells, but it didn't get inside the cells like it's supposed to. That's thyroid resistance. It can happen. The most common problem associated with thyroid disease is autoimmune thyroid, Hashimoto's. Here's another question to those of you listening. Have you ever had your thyroid antibodies tested? Many people, not so much. Let me talk about autoimmunity. And we're going to talk about it in relationship to thyroid, but it kind of, some of what we do for thyroid goes true for all autoimmune disease, actually. So what is autoimmune disease? First of all, it's a situation in which your own white blood cells have begun to attack your own tissue. Not a happy situation. In thyroid disease, it accounts for about 90% of thyroid disease. So I could see 10 of you and tell y'all you had Hashimoto's, and I'd be right 90% of the time. If I was a baseball player, I'd make a lot of money. You want to do the right testing, though, to make sure that is truly what you're dealing with. Hashimoto's and Graves' disease, which is another autoimmune attack on the thyroid gland, a specific part of the thyroid gland, are really not problems, are they? They're really system problem. My immune system is attacking my thyroid and creating the problem. The cause is my autoimmunity. Maybe that needs to be dealt with, which is true for almost any autoimmune disease one can have. When we start talking autoimmunity, we do start talking about gut. That's why gut is included in the title of this. Your gut is responsible for so much. It's more than just a delivery system of food in and junk out. It is that indeed. But all the bacteria that live in your gut provide important DNA and signaling to the rest of your body. Your gut and your brain are actually very intimately related, and what goes on in your gut has a profound effect on your brain, and vice versa. Leaky gut is something we deal with not infrequently around here. To which you go, ugh, leaky gut, that sounds awful. And it is, but not probably in the way you may be thinking of. Leaky gut is a situation in which your digestive tract becomes more permeable than it should be. In other words, what should happen is that we fully digest our food, and that and only that is absorbed through these little finger-like projections, these little tentacles, these villi that are hanging out in there, and it gets absorbed through the cell and gets put in our bloodstream. And junk, which we want to be eliminated, toxins we're trying to get rid of, not completely digested food we're trying to get rid of, stays out because those cells are very tightly knit together. Well, what happens is that tight knit between the cells begins to break down, and as it breaks down, the cells separate a little bit, and now we have junk leaking between the cracks into our bodies. The fact that that junk is leaking in there, and your immune system has to deal with it, gets your immune system all revved up. And every time that junk comes in, let's say gluten, your immune system has to go to war against it. And in its hyperexcited state, now what's it going to do? It's going to go around your body and say, I want to attack anything that even looks remotely like that gluten. That thyroid tissue looks a lot like that gluten. I will attack it too. Or that brain tissue, or that cartilage tissue. And this is what happens. And it's not only gluten, there's other foods. I pick on gluten because it's probably the biggest one we deal with. So, when we're dealing with autoimmunity, we have to be dealing with gut health as well. If you have symptoms, I have indigestion and heartburn and constipation and diarrhea, and you got leaky gut. If you don't have symptoms, this is good, but you might still have some difficulty with leaky gut. So it is one of the things we're always trying to be aware of and properly assess. So we do want to look for answers, but we have to ask the right questions, don't we? It's not what is the name of the condition I have, but rather what helped create the condition I have. So I want to speak for a few minutes now about help and getting help. Do you want to optimize your health?
Yes.
Yeah. Now, before you really answer that question, I want you to be aware of this. Optimal health, I think, should be desired, but optimal health does not come in a pill bottle. It can't. It's not even possible. Optimal health comes often by some hard work people have to do. Hard work, not because it's dangerous, or hard work because I've spent a lifetime doing the opposite thing. I've been doing this for 60 years. I got to do something different now. Darn. Yeah, you do. But if there's a way for you to be guided in that, would that make it more palatable? Yeah, I think so. So yeah, we all want optimal health. The question you need to answer is, do I want to work for optimal health? I hope you do. In our clinic, this starts with the 3 T's. Testing, treatment, teaching. It's what we do. And we don't think that a program is successful unless you address all of those areas. And let me get into that just a little bit. So on the testing front, I have a list of several tests that we do in the clinic that I'd like to just briefly talk about. They each have their own unique thing. What you see up on the screen right now is a list of the tests done in my custom-made blood panel. I put that up not because I expect any of you to know what's in there. Unless you're a professional, you probably don't. And as I say to people as I'm talking to them, if you did, you'd probably scare me a little bit. But I put that up there, and I do give this to patients because I want you to be aware of all the stuff we're looking at one shot. And this is important because when we go to our standard medical practice physician, what that doctor is able to order is really generated by what insurance will pay for. That's true even in the medical professionals in our clinic. If we're going to go through insurance, we are all limited into what we can order based upon your set of symptoms or your past diagnosis. Our problem is that doesn't really do a good job of telling us how the whole system is working together, does it? It does a fine job most of the time telling us about pathology. Where am I sick? Where have I gone off the road and I'm sitting in the ditch? Doesn't do such a great job of telling us about how did I get into the ditch? How do I get myself out? Am I riding the rumple strip of the highway and I need to be aware of something here? Because guess what? In the roots of this whole situation, your body's integrated together. It's not the individual limbs and pieces. So we need to take a close enough look to find out, all right, what does the whole system look like and how is it working together? So this is our attempt at trying to do that with people. So when we do this panel, I sit down with people and go over the report. How many people have had a doctor sit down and go over their lab report with them and explain stuff? I need you to know what's going on. You got to take care of this body when I'm done with you. In this report, which is really cool, what you're going to see there's a couple of columns, and on the far right column is lab. This is what lab says normal is. And if you're outside of that number, you're going to get a red put there. The next column to the left is functional. What is the optimal amount I should have? And if you're outside of that one, but lab says you're normal, we're going to give you a yellow. And if you're within all of it, you get a green. So now we're looking at, okay, I see where I'm off the road and in the ditch, but I see where I'm riding the rumple strip of the highway. What does that mean? Hopefully that's where I come into play. Also, what you should be aware of is that when we look at labs like this, we're not just taking it piecemeal one test at a time. We're looking for patterns. Several of these do go together. And if you have one here and there out of whack, it may not be such a big deal. But if you have a pattern, I got 3 or 4 of them and they all go together and they all point to this. Maybe we better be dealing with this. And that's how we go about interpreting that stuff. This is one of the panels looking at food sensitivity. Yep, there's 2 of them from Cyrex Lab. One of them is gluten specific. The other one looks at other foods. And it does a similar, notice there are columns in that one too. So if your number happens to fall in the green, we're good. If it's in the yellow, and especially if it's in the red, guess what? You're overreacted to that particular food. We maybe ought to think about you not eating it for a while to get your system to calm down. Because maybe every time you eat it, it has a negative impact on whatever we're trying to work on. It's a bit of testing that frequently doesn't get done medically. Medicine has allergists. This is not testing for a true allergy. This is testing for a hypersensitivity reaction. There are 2 types of reactions people have. One is an immediate sensitivity. That's what we call a true allergy. It's the one that causes what we call an anaphylactic reaction. Oh my goodness, I ate peanuts and my face swelled up like crazy. That is what mostly gets tested in medicine. Good testing, good to know. What I'm looking for is a sensitivity reaction. It involves your immune system, but a different part of your immune system. And a person may not react to that in that fashion for several days. So you could eat the food on Monday and not react to it till Thursday morning. Makes it a little difficult to figure out what's going on. Thus, we like to do some testing to try and figure that out. And that doesn't often get done in a standard medical practice. I did mention gut. This is the first of a rather large report on a stool specimen. We are looking for a lot of stuff with this. We are looking for common things, or things that are commonly looked at when a stool specimen goes in. Do you have parasites? Yeah, we can this checks for that. Do you have C. diff or some other pathogenic bacteria that's overgrown? Yes, that's in here. But this goes way beyond that. When we're talking about the bacteria in the gut, there are a couple hundred different types of bacteria that live in your gut. And they should all be there. Even the C. diff should be there. But it should be there in a really small amount. We want to know what the balance of all those bacteria are in your gut. Because when your gut is unbalanced, you're going to have leaky gut. You might have symptoms as a result of that. Unbalanced can mean I actually have too many of that which we consider good bacteria. That's unbalanced. It's kind of like the orchestra that's playing this beautiful piece, and the piccolos decided they're going to play extra loud that night. That's going to ruin the piece. So we're looking for that. This also assesses inflammation. How much inflammation is down there? And different inflammatory markers tell me something about the cause of the inflammation. It's also going to assess how well are you digesting your food. That's huge. That's just huge. When we talk about food sensitivities, we also talk about how well are you digesting your food. Because maybe that's how you got that way in the first place. So this gives us a good assessment of that. This is a test called a brain span test. This is the result page of that. Fascinating bit of testing. You actually go online and do a few online tests to assess kind of the performance of the brain. Kind of cool to know. It's pretty simple to do. It's kind of fun to take, actually. Then we give them a drop of blood and have them assess basically some inflammatory markers, and especially looking at your omega-3 to omega-6 ratio, or more appropriately, omega-6 to omega-3 ratio. Omega-3 essential fatty acids are anti-inflammatory. Omega-6s are generally pro-inflammatory. Most of us in our diets get too many omega-6s and not near enough omega-3s. So this gives us a read into that, and it gives us an opportunity to check it at a later date to see if you, as you're going through some care, that you are getting some improvement in this as well. This is a test looking at adrenal activity. And really, I'm going to focus a little on that right-hand side of that. We get a saliva specimen at 4 specific times in the course of a day. And notice as you look at the green that there's a pattern to this. We should have more earlier in the day, and it should tamper down as we go through the rest of the day. This particular test starts the day okay, but notice it doesn't go down like it's supposed to. That's a problem. With extra cortisol at the end of the day, extra stress hormone at the end of the day, do you suppose that person has a difficult time getting to sleep? Yeah. Cortisol, that stress hormone made in your adrenal glands, also has an effect on how your thyroid works, and vice versa. So it is a test we do not infrequently with people. Testing. We must have proper testing. In order to have, or for us to figure out the true cause, you need to ask the right questions. That's why we do what we do here. So we are going to look at dealing with that cause and not just symptoms. Does us, I shouldn't say no good. Certainly, taking medications and doing strategies to reduce your symptoms is huge. Nobody wants anybody to walk around suffering. But that's a little like the smoke alarm going off in the corner, and we don't like the sound, so I'm just going to take the batteries out. Feel better, but it didn't really stop the fire, did it? We want to kind of get to that fire. One of the things we think people need is step-by-step training. You need some help. How many of you have been to a doctor who said you need to eat better? How is that? Or we've been to the doctor and they handed us a sheet of paper that says, here, do this stuff, and they walked out of the room. I don't blame them. Time is an issue. Nobody's got time to sit down and do that. But you're left with this in your hands going, what a great idea. And you walk out of the thing and you leave it in the back seat of the car, and 3 weeks later you go to clean out the car, and there it is sitting in the back seat. I never did start that, did I? Because I didn't know how. So one of the things we like to try and provide is the how, and give you people that can help you to do that. Which means you need a mentor. You need someone to keep you accountable. Yes, we all need to have some accountability in our life, don't we? That's why I'm married 35 years. What can I say? But, contrary to what my wife says, I am trainable, so there you go. It might involve some classes and homework, and we do give that people here. We have classes such as this regularly, talking about various topics. In fact, in a second I'm going to talk about the 5 pillars, and we talk about those 5 pillars in our classes. And you meet one-on-one with a coach, and she might have you do some work, like keep a journal and things like that. We need to do that. I don't want you to leave here thinking there's a magic pill. I don't want you to leave here doing the work and feeling good, and 10 minutes when you drive out of the parking lot thinking you're done. I want you to take care of yourself well for the rest of your lives. That's what we need to do. That's optimal health. That will make healthcare costs go down in the world. 5 pillars: digestion, nutrition, hormones, exercise, brain. We try and address all of those as people come into the clinic and work with us. I've talked about several of them already. In fact, I think I've probably talked about all of them, haven't I? It all has to be working, and it all has to be in balance, and we have to figure out the right way to deal with it, and then teach you how to deal with it. So, where would I be, or how would I feel if I could resolve my health issues? I do want you to take a few minutes with these questions and think about them, and not just slough them off. Because many people, especially if you have something chronically, are like, it's the way it's going to be. Maybe it has to be that way, but maybe it doesn't. What would it look like if it weren't that way? Many of us don't stop to think about that. Which means, how's my life been affected by what's going on? Does it affected my relationships? Do I get home at the end of the day and, here, take the baby, I can't do any more of this? And it wasn't my wife's fault, it's just the way it was. How is it that affected? I really want you to think of this one. On a scale of 1 to 10, how motivated am I? And I want you to really think about that, because we like dealing with A and B students. How do you know an A or B student? Well, they're sitting up front, they're paying attention, they're doing the homework, they're studying, they're doing the stuff they're supposed to be doing. If you answer this, probably a 5 or 6. Okay, that's okay. You're not right for the program we have in the clinic. If you're at 8, 9, 10, I'm all in with you. I don't want to drag you into something you don't want to do, but I really want to help lead you to something you want to do. There's another question that's not up here too that I like people to ruminate on a little bit. If you do nothing, how might that look 5, 10, 15 years from now, knowing what you know? And if you kind of don't like that answer, or are a little bit scared by the answer, that's okay. Maybe you'll do something about it. Mentors. Yeah, we have them. We call them health coaches, but they're really your buddy. They're your mentor. There's someone in there to help you. Sometimes kick you in the keister once in a while when you need it. I like this. Tell me, and I may remember. Show me, and I will remember. Involve me, and I will understand. I talked a little bit about how your thyroid is working. Most of us have no clue, or very little clue, how our bodies work, which means we have no idea really what normal should look like. I really like to fix that with people. You got to know how it works and how to take care of it. It's like buying the car and never changing the oil. You got two choices. You can keep doing what you're doing, and that's fine. If I never hear from you or see you again, God bless you all, and do the best you can. That's terrific. Or you can do something about it, and we have something that one can work on. So one of the things that we have available for you is something called our Transformational Health Programs. We love that word, transformational, because we really think it does change people's lives, and change people's lives for the long term, not just for today or tomorrow, which it will do as well. You might not be right for that program. So those of you sitting in my audience this afternoon, this is available. Those of you listening on the internet, this is also available to you. And you simply need to call the clinic. So what we like to do is an evaluation, whereby you will come into the clinic, and we want you to come into the clinic prepared, filling out paperwork we're going to give you to do, bringing all the information that you have available to you, at least in the last few years, so labs and x-rays and things like that, and we will sit down and go over your health history, go over what you've had done, and talk about whether you're right for this program or not. Now, it involves a consultation, a wellness evaluation, and then we will come up with a plan of action for you. We'll have a plan. There is some fee for that. We're going to spend a good 45 minutes with you in the clinic. Sometimes a little longer if we've never seen you before. So there's a fee for doing that, and normally that would be $280. But those of you here tonight, and if you mention this when you call up the clinic, the fee is actually going to be $85 to do this. And if you also want to bring someone in who might want to be involved in that program, you can do that, and we'll even make it a little more affordable for them at $45. So that's something that as you schedule, we'll ask you to pay for, but I think you will find, even if we do nothing but sit down at that visit and we don't do anything more, that it's well worth your money. I do, however, want you to come prepared. As I said, fill out your paperwork. I'm old, it's paperwork to me, but it's actually online stuff. When you schedule, we will send you a link that you can open up, and it will fill out as completely as you can all the data about you. The more I know about you, the better job I can do of helping you. To that end, bring in, like I said, your past records, certainly in the last few years if you can. All your lab tests, any diagnostic imaging, that type of thing. Again, A, I don't need to reinvent the wheel, but B, I want to know where you've been. And so as good a job as I can do would be as good as information as you can give me. Last is bring someone with you. Kind of a couple of practical things with that. You know, my wife and I will go to doctor together. She'll have me go with her. I am one, so I interpret quite a lot, but it's always very interesting to me what she hears and what I heard in the same visit. So it's really nice to have someone to be able to bounce that off of, two of you. Or you get home and what did the doctor say? Well, he said, let's do this. Well, what did he say about that? I forgot. Or, oh, I didn't think to ask that question. Kind of nice having that person in the room with you. Also, at that visit, we often make some recommendations as far as treatment plans. So there's some financial stuff that shows up as well, too. So again, if there's someone that you would like to bring with you, we highly encourage it. If you're married, we encourage the spouse. They'll tattle on you anyway, so that's kind of cool. And so then you can make an intelligent decision, and two of you can do it together. So we really encourage you to bring that. So those three things are really what we'd like when people come in for this. I like this. Sometimes that thing holding you back is all in your head. Now that can mean, well, it means that, actually. When we're talking about things like chronic disease, when we're talking about ways to help yourself, it's in your head not because you're lazy or because you have your head buried in the sand and you just are, the word is ignorant. You just don't know yet. But once you know, you can do something about it. So this is where we come from in our clinic. Our transformational program, where we can sit down and do the proper testing. We can use our health coaches and teach you what to do. And we can get to the cause. We can get to the roots of the situation, if you're willing to work at it. I hope you are. Anyway, thank you for your time today. Hope to meet you soon. If I don't ever again, God bless you all.